Hi everyone, how are you all? I hope you are fine and safe. So, this is Harshita. So, today we are going to discuss an important topic, that is emphysema. So, before starting it, let's know the obstructive lung diseases. Obstructive lung diseases. These obstructive lung diseases is divided into three types. Okay. First one is chronic obstructive lung disease. Second one is bronchial asthma, and the last one is bronchiectasis. So, in this COPD, we come across two diseases. First one is emphysema, and the second one is chronic bronchitis. So, before knowing what is emphysema, first let's learn the definition of the emphysema. What is the definition of the emphysema? There is irreversible enlargement. So, first point is irreversible enlargement. Enlargement of the sinus. Next one is, are there any specialties? Yes, there are two specialties. First one is destruction of the walls. Second one is, it is all happening without fibrosis. So, the definition of the emphysema is, it is an irreversible enlargement of the acini, okay, with destruction of walls and with no obvious fibrosis. So, this is the definition of the acini. So, next one is pathogenesis. So, the pathogenesis is very important. Pathogenesis means how a person is getting emphysema. For example, a patient came to you with a history of smoking, or you examined him, then you came to know that he is a deficient of alpha 1 antitrypsin. The person may be smoking or may be a deficient of alpha 1 antitrypsin. So, because of this, there will be increase in the elastase activity. So, because of that, there is the destruction of lung walls or lung architecture. So, it leads to the disease we are learning now is emphysema. So, a person came to you with a history of smoking and you get to know that he is a deficient or he may be having a deficiency of alpha 1 antitrypsin. Okay, so because of these two conditions, the elastase activity increases, which leads to the destruction of the lung architecture, which is called as emphysema. So, depending on the location of the acini, we discussed that acini is getting affected. So, what part of the acini is getting affected is very important now. So, what part is affected? So, first we should know the parts of the acinus. So, acinus is having three parts. I already told you in the introduction part. If you not seen the introduction part, please go and see the introduction part. So, acinus is having three parts. First one is respiratory bronchioles, alveolar ducts, and the third one is alveolar sacs. So, these are the things that are present in the acinus. So, depending on the location that is getting affected, the emphysema is divided into four types. First one is centrilobular. Second one is pan-acinar. Third one is paraseptal. It is also called as digital. And the fourth one is irregular. Okay, everything lies in the name. Okay, everything lies in the name. So, first let's divide it into four parts. So, first let me draw the diagram. So, this is the diagram which is very important. So, first one is tertiary bronchi. This is respiratory bronchi. And these are alveolar sacs and alveolar ducts. Okay, depending on the position that is getting affected, these are divided into 4 types. So first one is centrilobular. Centri. So what is getting affected? In these 3 parts, what is the center one? So if we think that this is the first one, this is the second one, and this is the third one, this respiratory bronchioles is getting affected. So this is centrilobular. So the important points are, this is the most common one. So this is the most common one. Second point is, the area which is affecting is nothing but the respiratory bronchiole. And the third one is, why the patient is affecting with the centrilobular acini. Means there are only 2 conditions. First one is smoking and the second one is alpha-1 antitrypsin. And here he is affecting by smoking. And the last one is, if it is a lung, majorly the upper lobe of the lung is getting affected. So this is all about the centrilobular. Okay, and the second one is, let me change the color. Second one is pan-acinar. Pan-acinar means all the layers are getting affected. So what are the parts are getting affected? The parts are nothing but the respiratory bronchi are getting affected, and alveolar sacs and alveolar ducts all are getting affected. Okay, and now entire acini is getting affected. Entire acini. Entire acini is getting affected. And the next one is, what is the reason? Reason is nothing but the deficiency of alpha-1 antitrypsin enzyme. So this is the main reason of getting pan-acinar. And next one is, if this is a lung, majorly the lower lobe of the lung is getting affected. Okay, and the third one is paraseptal or digital. The name itself says it is digital, means only the alveoli is getting affected. Okay. Second one is, it is due to the spontaneous pneumothorax. Okay, and the fourth one is irregular. What is irregular? Irregular enlargements. So enlargement may be in the respiratory bronchioles or alveolar sac or alveolar ducts. Okay, it is irregular. So it is the most common histological type. And here the any part of the lung can affect it. Any part, because it is irregular. Any part. I hope you understand. So this is all about the emphysema. So first we saw the types of obstructive lung diseases, and next the emphysema. First we learn about the definition. So definition is very important. We learn the definition, pathogenesis and the types, and we have also cleared the types. So this is all that you should know about the emphysema. Okay, I hope you understand it. If you have any doubts, please let me know in the comment section. If you like the video, please consider pressing the like button, and please do share the video and subscribe to the channel Teddy Guides You. This is K. Harshita. Thank you so much.